Hi everyone, it's Lauren Gates with Airway Health Solutions, and the moment has come. I am with Dr. Kevin Boyd, who is now joining us with Airway Health Solutions. Welcome, Dr. Boyd. We are thrilled to have you on board as faculty. Tell us a little bit about big plans with Airway Health Solutions and what curriculum you have in mind.
Well, if Airway Health Solutions was a school, pre-K through 12th grade, I want to be the preschool superintendent, and teacher, and really preschool age children, age 2.5, 3 years old to under 6. That's what I want to add to what you've already created here. I'm honored to be part of this.
Thank you. And what is your goal in this curriculum? I know you're so passionate about pediatric oral airway health, and tell us a little bit about your end goal, if you would.
The end goal is to optimize a child's craniofacial and respiratory complexes, which are conjoined from birth, from in utero, to optimize it for nose breathing at the earliest feasible age, meaning the earliest time that a kid gets to my office, or earliest time that it makes sense to parents that, oh my gosh, this is a component of good parenting. Didn't know that. Quality and quantity of life is the ultimate goal. Aging starts in early childhood. You set kids up now for optimized wellness, meaning not just, food and exercise, but also sleep and breathing. They're going to live longer, and they're going to stay healthier longer into their old age. Health span is increased.
And we are thrilled already that we have 2 courses that are available at Airway Health Solutions, and one is in screening. So tell us a little bit about your goals for that course. It's a half-day course. Tell us why screening is so important.
I think it's not, people will say, well, Boyd, he's pediatrics, and I'm a prosthodontist or an endodontist. What does that have for me? And it's like, well, you know what? You don't have to treat or even want to treat these kids. And even learn how to treat them. But you do need to know how to screen. And that's, right from the American Dental Association, that for over 3 years now, the ADA is behind this, that airway health is a component of oral health in as much as plaque-mediated diseases, gingivitis and caries. So this is something that your responsibility, if you see adults with problems, their problems maybe began in early childhood, and they don't want their own kids to have these problems. So if you do some screening on your adult patients, and hey, Grandpa, I heard you had a grandchild, your daughter had a kid, find out if he snores. If he does, something should be done about it. You might be the first person. You don't have to be a pediatric specialist or a GP that even sees kids. Those are the people we really want to reach, but anybody in healthcare should know about this.
Absolutely. And the second course we created, I find there's a lot of barriers in the fear of treating children. And how long have you been treating children? And tell us a little bit about how you're going to help alleviate that fear with your tactics and techniques.
Well, I've been a pediatric dentist since 1988, when I finished my fellowship in pediatric dentistry at the University of Iowa. I came out, I wasn't married, I didn't have kids. I didn't really know much firsthand about parenting, except what I remembered about being raised by my mother, earlier on. So I'm saying you don't really need pediatric behavior guidance training to do this well. If you're a parent, you can be retrofitted to do this, and that's what we're going to teach. It's just like in World War II, they turned car factories into tank factories. If you're a parent, or if you've been involved babysitting, doing anything, you know children, and you can do this. Kids are hardwired to want to be obedient to adult elders. They just are, or we wouldn't be here now. And that's the anthropological edge to it.
Well, we are just thrilled. I'm so thrilled to have you on board. I know Dr. Ben Moralia is thrilled to have you on board. Welcome. We're really excited about these 2 courses just to get the ball rolling. More future courses in store in early pediatrics. And thank you for joining us. We are so thrilled. Now the fun begins.
I'm honored, and I'm very optimistic of what's going to happen here.
Thank you.
Thanks, Lauren.
Please go to Airway Health Solutions. I'll put it in the comments, but it's airwayhealthsolutions.com/Boyd, and you can sign up for our courses right away. We do have an AAPMD special that we are extending, so reach out to me and I can tell you how to get that discount. Thanks everyone. Thanks Dr.
Great.
Boyd.
Okay.
Let the fun
Have
begin.
a good one. Bye-bye.
Take
See you
care.
then.